Here, what are you gonna do for?
Hello, everybody, and thank you so much for joining us today. Good afternoon, and thank you for joining our presentation on Over 65, Importance of Taking Care of You.
Yes, I'm sorry to interrupt you.
I am Joseph Aguilar, and alongside I have Destiny Delgado, standing in for Heather Williams, your QPIC Population Health Manager for your Aetna Hope Health or ACO programs. Should you need assistance in finding an in-network provider and specialist, please reach out to me at cupic@healthtexas.org or call me at 210 210-920-9301. Our speaker today is Dr. Tamri McClelland with Health Texas Medical Group at our Paramvital Clinic. Dr. Tamri McClelland was born and raised in Texas and is board-certified family medicine physician. She is highly admired by her peers for her outstanding quality of care and passionate drive to improve the health and lives of her patients. She enjoys partnering with her patients in their healthcare needs. Dr. McClelland feels a family physician is more than just a doctor. The family physician is to teach their patients and their families about proper medical health so they can enjoy vibrant, healthy lives. Dr. McClelland also treats women's health issues and migraine headaches. When not treating patients, Dr. McClellan enjoys reading, traveling, and gardening. She also enjoys supporting her local community through the San Antonio Rodeo.
Hello?
We are recording the session,
Hello?
and we will send to each one of you once the recording is available. The recording will be emailed to those who pre-registered and will be posted onto our YouTube channel once finalized. Also, to note, a survey will be sent to everyone who attended today's event. Please complete the survey and let us know how we did and what other wellness topics you would like for us to cover. Our next health talk, will be held on September 26th. It will be mental health time management. It will be hosted from 12:35 to 1:35, and another health talk on September 27th that will be focused on men's health. Now that time will be from 12 to 1 p.m. Should you have any additional questions, please place them in the chat and we will review once the presentation has finished. We will now begin with the presentation momentarily. Thank you so much.
I would prefer coming up with you. I don't feel like that's the last. And the last
Hi, I'm Dr. Tammy B. McClellan. I work at Parent Vital Health Texas, and our purpose of this talk is to kind of take care of your health as you age. And so we'll cover several things. We'll cover preventive. We'll go ahead and cover things that can slow down the aging, things that can speed up the aging. And the objectives is to go ahead and know the importance of healthy aging, improving physical health, tips of getting active and fit, importance of getting rest, sleep. The new goal is 7 hours and 15 minutes, and strengthening mental and emotional health, prevention and management of chronic diseases, and reducing the risk of health problems and improving habits to lead to an optimal life. We go to the next one. Do I need to turn them? Oh, so what is health? We'll go through. What is healthy aging? Healthy challenges with aging, wellness, the key to healthy aging, and 7 dimensions to wellness. So what is health? Health is defined as a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. That's the definition by World Health Organization. World Health Organization defines healthy aging, and aging is spelled correctly. I looked it up for all of us. I think that's a European way of spelling aging, is the process of developing and maintaining the functional ability that enables well-being in older age. Functional ability is about having the capabilities that enable all people to be and do what they have reason to value. So healthy aging, early life, it shows that you go ahead, and most people are born without any disabilities. As you get older in adult life, you can have normal functioning. And as you age, there's 2 different curves. You can have more trouble and have trouble maintaining your independence and preventing disability, or you can age in a healthy manner. What we want to do is we can't avoid the aging process, but we can age in a way that you're able to be not necessarily a disease-free body, but as healthy as you possibly can. So both of these women are 80 years old. Obviously, the one on the left is very health conscious, exercises regularly, has very great posture, muscle tone. The one on the right, definitely poor posture, poor muscle tone, and definitely has problems with mobility. They do say it's never too late to build muscle mass. Being in bed and bedridden, you can get muscle atrophy in 3 days. Once we understand what to expect as we age, we can work with our bodies to age and engage in an ongoing improving process to achieve that goal. So health problems in old age. And so what's common in both sexes, cardiovascular issues are hypertension, coronary disease, and stroke. Neurological, senile dementia, Alzheimer's, Parkinson's, memory loss. Endocrinology, a big one here in San Antonio is diabetes. Respiratory, it could be infections, COPD, emphysema, also asthma. Musculoskeletal, osteoporosis, where you have bone thinning. Osteopenia is the step before bone thinning. Arthritis, loss of muscle tone and muscle wasting. We also have to worry about dental aspects, because if you can't chew your food, your nutrition may be decreased. Also accidents, malnutrition, and cancer. So healthy challenges in elderly men. If you have trouble with your prostate, you may have trouble with your urination. You could have cancer of the prostate, cancer of the testicles, erectile dysfunction. Also, men and women both can get cardiovascular and lung problems, as we already discussed. Elderly women, the problem is breast cancer. It can happen in males, very rare. Cancer of the uterus or cervix, uterine prolapse, where you have weakness of your uterus and it impairs your urination, and bladder incontinence. What is wellness? The World Health Organization defines wellness as the optimal state of health of individuals and groups, and wellness is expressed as a positive approach to living. So health versus wellness. So the primary difference between health and wellness is that health is the goal and wellness is the active process of achieving it. You truly cannot have health without first achieving wellness. Wellness has a direct influence on your overall health, which is essential for living a robust, happy, and fulfilled life. Wellness. Wellness is a holistic integration of physical, mental, and spiritual well-being, fueling the body, engaging the mind, and nurturing the spirit. Lifestyle and a personalized approach to living life in a way that allows you to become the best kind of person that your potential circumstances and fate allow. And so the apple kind of shows us motivation, weight, fitness, resilience, well-being, exercise, opportunity, mindfulness, trust. All of these things go into wellness. So the illness-wellness continuum. So the illness continuum is on the left with disease and poor health. The wellness continuum is on the right. 100% function would be the far right, good health, and neutral is in the center. You could be anywhere along this aspect, and there are some ways that you can go ahead and shift your position. 7 dimensions of wellness: physical, emotional, intellectual, spiritual, environmental, social, and occupational. And so all of those go in together for the concept we call wellness, and it revolves around all those, the physical and mental well-being. So we understand that there's much more to it than that. So these are the 7 key dimensions of wellness that contribute to overall health and quality of life. So components of physical wellness: exercise. They're saying the new goal is 150 minutes of just mild exercise a week. It also can help prevent dementia, and it can also help with muscle tone. Nutrition and diet. I do check a lot more lab than I used to. Ferritins or iron storage, they become lower as people age due to diet and nutritional deficiencies. Physical health assessment: alcohol and smoking. So alcohol in large quantities can increase your risk for dementia, and smoking can definitely go ahead and increase your risk for cancer. The other last component of physical wellness is rest and sleep. As I mentioned earlier, 7 hours and 15 minutes is optimal. What happens at that point is your brain shrinks up. The fluid around it, called your cerebral spinal fluid, washes away the tangles that lead to Alzheimer's. The other one that can also decrease your risk for dementia is vitamin D. And so that's a lab test that can be done. So the purpose of this is caring for your body to stay healthy now and in the future. Recommended types of exercises: the 4 that we're going to go over: endurance or aerobic. Usually the endurance exercise is 150 minutes per week. Aerobic, if it's heavier exercises, 120 minutes a week is enough. When patients ask me, should I walk or run? Either one's fine, depending on your body. Most people above 65 are not, but there few are. They just don't have to run as long. So walking is just as healthy for you. Strength, and that's what helps build muscles. Weight training can do it. Resistant bands like the isometric bands. Balance is important for fall prevention. Tai Chi, low impact exercises, You can do something as simple as standing on one foot when you brush your teeth, but go ahead and hold on to the counter to be on the safe side. Flexibility exercises mainly consist of stretching and yoga. They help keep your muscles limber, and this can help keep you lean and in good shape. Benefits of exercise: improve cardiovascular health, improve cognitive function. It reduces anxiety and depression. The reason why for number 3 is exercise increases your serotonin. It also helps with flexibility, exercise, improve strength, and improve bone density. Bone density, to increase your bone density, needs to be weight bearing. So walking alone doesn't count. It's better than nothing, but you would do a weighted vest or a weighted backpack, and that would increase it. And step aerobics or jumping jacks would also be weight bearing for bone density. Benefits of exercise: decreased risk of falls. It helps with weight loss. It improves your sleep. You usually, most people do a social connection when they exercise, although some people do it alone. It increases confidence and it increases lifespan. So I'd already gone through, adults should get at least 150. This one says up to 300 minutes of moderate intensity exercises per week. If it's vigorous exercise, most people don't play basketball anymore, but some do, or running, it's just 75 to 150 minutes a week. Additional health benefits of at least 2 days a week of muscle strengthening, and also muscle strengthening activities that involve major muscle groups. The stretchy bands can help, or the TheraBands can help with that. We're going to go through nutrition. So on nutrition, it's the food pyramid. This has been the one they've had for a while. I'll talk about salt later. So mainly more of a Mediterranean diet, Mediterranean paleo. A good source is Healthy 7. You can find it online, HEALTHY 7. Ignore the 7-layer dip recipes that also pull up at the same time, because that is not a healthy choice. So bread, pasta, cereals, 6 to 11 servings, vegetables, 3 to 5, fruit, 2 to 4, meat, poultry, beans, eggs, nuts, 2 to 3, milk, 2 to 3, and fats used sparingly. And so this is the reverse pyramid, and it's changed since I've been a young girl. Rest and sleep. So the rest is important, as I discussed, to go ahead and let your brain relax. What happens also when you rest is you store information, but you need enough uninterrupted sleep for that to happen. So when you sleep, we're shooting for, I'm usually telling patients 7 hours and 15 minutes. If you have too much sleep, that can somehow shorten your life expectancy, but anywhere up to 9 hours is healthy. You can have a nap, but usually I tell patients to restrict it to 20 to 30 minutes. A longer nap can interfere with your sleep cycle at night. It does need to be a dark, quiet place. The other thing that's important is you've got to stop the TV, the electronics, the phone. There's something later inside. It's just sex and sleep happens in bed. TV, we don't recommend watching in the bedroom. If you have a blue light from your Kindle or phone or laptop, we're saying that needs to be turned off 30 minutes before bedtime. And so to lose weight, what's important besides just diet is also sleep, because they say it helps with your cortisol levels. There was a question that we had online. So for weight loss above 65, we still say you can lose some weight. Usually 10 to 15 pounds is plenty. Above 70, 75, we say kind of limit it to 10 to 15 pounds. The way to lose a half a pound to a pound a week is you cut back. If you're exercising 30 to 40 minutes that day, you cut back by 200 calories. If you're not exercising that day, you have to cut back by 500 calories. But the sleep's important for that only. So as I said earlier, bed is just for sleep and sex. Watch the TV. Restrict the time in bed if you're not asleep. You can get up, but don't spend too long. Avoid caffeine, nicotine, alcohol at least 3 to 4 hours before bedtime. Large meals at bedtime, that can increase your risk for reflux and make it more difficult to sleep. Try to be on a regular schedule, and especially for patients with migraines, you don't want to vary the time by too much, usually more than an hour. So we're saying on the weekend, don't sleep that much later than you do through the week. So keep in mind, daytime naps also affect nighttime sleep. A short one would be okay. Cigarettes, alcohol. I'm a physician, so you know I'm not going to recommend either one of those. So risk from smoking. A huge one is aging. So it's not just sun, it's also smoking and alcohol. So smoking can affect your lungs, your blood system, your kidneys, your colon, your cancer. It does increase your risk for aortic rupture, pneumonia, it does definitely increase your risk for atherosclerosis and also COPD and asthma, and it can reduce your fertility and affect your bones. So the health effects of alcohol, that one's tiny print. I apologize for that, but realize that alcohol can increase risk for stroke also, mainly also cause cerebral atrophy, which is shrinking of your brain, and it does increase your risk for dementia. High amounts of alcohol can also even lead to seizures when you stop it suddenly. So maximum weekly alcohol guidance, a lot depends on if you have any other medical conditions with it. If somebody has fatty liver, we're not going to recommend this much alcohol. Now, 6 pints of beer. Problem with beer is there's more salt in it, and we'll discuss salt later. So they're saying 6 glasses of beer maximum per week, or 7 glasses of wine, or 14 single shots of alcohol. Usually I'll tell patients no more than 2 in a night, and try not to have alcohol every night of the week. Physical health assessments. Certain measurements can be used to test your physical health. One of them is called body mass index. So when your doctor refers to BMI, it includes your weight and height, and they calculate where you should be on the spectrum of your body mass index. We do recommend that you get your blood pressure, cholesterol, and sugar checked at least yearly, more often if you're diabetic or if you have hypertension. Physical assessments include body fat composition or percentage. It can be done with calipers. It can be done underwater. Flexibility, muscular strength, and endurance test. Periodic medical screening. You should visit your provider at least once a year for screening to prevent any problems. We also screening for age 65 and above. Bone density is recommended for both males and females. Females, mammograms are recommended until the age of 75, longer if there's a personal history, and at least an eye exam every other year. So your physician will screen for medical issues, assess your risk for future medical problems, and encourage a healthy lifestyle. It'll help you let your provider know, and be sure and see them sooner if you have any illness or any symptoms. So have a yearly physical. Most insurances cover it at no cost. We check your height, weight, body mass index. Usually with above 65, we're also going to screen for depression and find out if there's any major problems going on. So BMI normal is 18 to 24.9. Overweight is 25 to 29.9. Obesity, 30 to 34. More of a problem if you're diabetic. So you can be obese and still be at risk if you're diabetic. Morbid obesity is 35 plus. When you're obese, you're going to be more prone to get flu, illnesses. You're actually more prone to get cancer. Part of the treatment for breast cancer afterwards is to maintain weight or lose weight. Obesity, consequences of obesity can be heart disease, diabetes, fatty liver, and 1.5 billion people in the world today are overweight. And prevention, of course, diet, exercise, and sleep is also on there along with stress. So healthy screening tests. Blood pressure screening, have it checked at least once a year. If you have diabetes, hypertension, kidney problems, then usually you need it checked every 3 to 6 months. Diabetes screening, if you're 60 and older and in good health, you should be screened for diabetes every 3 years. I usually do it yearly because you don't know if somebody's had something to increase the risk, like been put on steroids or gotten an illness. Actually, sugars can go up if you have an infection. If you're overweight and have other risk factors for diabetes, ask your provider if you should be screened more often. Hemoglobin A1C is a 3-month average sugar for diabetics, and we check it every 3 months. If diabetes is not controlled, we'll sometimes go out to 4 to 6 if it is controlled. Diagnosing hypertension and diabetes. Sorry for the tininess of the slide. They've changed the guidelines, and I'm going to clarify on this side. There's there's more than that. There's several different guidelines by blood pressure. So the old one for people with kidney disease is 130/80. It still is 130/80. JNC 8 guidelines before the pandemic said 140/90 was fine. The American Heart Association, American Diabetes Association, and American Academy of Family Practice still are going by 130/80. So there's a disclaimer with this slide. The other one is 140/90. 140/90 is JNC guidelines. For 60 and older is the 150/90. A doctor, I've even talked to cardiologists, which one do you want to use? So the answer the cardiologist gave me is whichever one we want to. And so we'll still go by usually 140/90. Only occasionally will we let somebody be 150/90 if we're worried that we may drop them too low and cause symptoms. Diabetes, the goal is to get your sugar normal for no diabetes at all is 5.7 or lower. Pre-diabetes is 5.7 to 6.4, usually averages about 100 to 125. And diabetes is 6.5 or higher, and that's 126. We can diagnose diabetes with either a fasting sugar above 126 or a hemoglobin A1C. Remember that 3-month average sugar at 6.5 or higher. Most of us use 2 readings in case you had an illness and your sugar was higher, in case you were on steroids, in case it was Halloween and you went crazy with Halloween candy. And so we usually diagnose with 2 readings. Occasionally it's very high and you're at a dangerous level, we'll diagnose you with diabetes immediately. Next slide. Let's see, I'm having trouble moving them. Before it worked just a minute. Technical difficulty. Okay.
Let me see.
Okay.
Sure.
Next slide. Oh, cholesterol screening. So if your cholesterol is normal, have it rechecked every 5 years. I'd say 3 to 5. And normal cholesterol depends on the person. Patients get worried when their cholesterol is 110. So there's a different level for different things. For someone that's had a stroke or heart attack or has diabetes, we want the LDL, the bad cholesterol, to be 70 or less. If you have no risk factors, then 100 to 130 is usually fine. If you have high cholesterol, diabetes, heart disease, or kidney problems, we definitely check your cholesterol at least every year, sometimes more often. Colorectal cancer screening, it's dropped down to 45. It does continue until you're 75. One method to screen is FitCard, which is fecal occult blood testing. So much easier than it used to be. They're only good for 1 year of screening. It's something you do in the privacy of your home. And now they're just 1 sample instead of 3. They do screen for blood, cancer, and precancer. FlexSig's not usually done that much anymore. Those are done every 5 years, but you'd have to do a fecal occult blood testing every 3. Colonoscopy is every 10, and that's if it's normal. If you have polyps or anything else, especially precancerous polyps, they're going to drop it down to 3 to 5. The other one that's not listed here is Cologuard. That one does last 3 years for screening. I have a tendency not to use it as much, more complicated. You have to poop in the box and mail it. They have a lot more false positives with that. And on the fecal occult blood testing, in case your doctor doesn't tell you, especially the 45 years to 50, be sure not do it when you're on your period or if you have any hemorrhoids acting up. So depending on your history, you may need to be screened earlier. Someone has a family history, they usually drop down 10 years below. Is that me? So PSA, we do it through 55 to 69. And then it depends on if someone is 65 and in a wheelchair, they're not ambulatory, they wouldn't be able to survive treatment. So we would not necessarily test for that. We also use PSA to screen for things like prostatitis. Osteoporosis screening, we kind of mentioned earlier. The recommendation is anywhere from every Sorry about that. I got muted by accident. So environmental health is just your social, natural, and built-in environments that affect your health and well-being. Emotional wellness, it's important to understand and respect your feelings, values, and attitudes. Appreciate the feelings of others. Manage your emotions in a constructive way. They're teaching all the babies now and the little preschool kids to belly breathe, feeling positive, enthusiastic about your life. There is a source. It's the COVID anxiety workbook. They came up with that during COVID because anxiety increased to 3 times normal, and it goes over deep breathing in real simplistic terms. Used to be a little book. UCLA came up with a study, and now it's a free download online. When I replaced we, even illness becomes wellness. And so it's saying we can all work with this together. Social wellness refers to the relationship we have and how we interact with others. Relationships can offer support during difficult times. Social wellness is building healthy, nurturing, and supportive relationships, as well as fostering a genuine connection to those around you. Also with social wellness, during COVID, we asked more about people's pets, and so they can help too with your emotional support. Mental wellness, growing intellectually, maintaining curiosity about all there is to learn, valuing lifelong learning and responding positively to intellectual changes, expanding knowledge and skills while discovering the potential for sharing your gifts with others. One way to also help with dementia or even mild cognitive dysfunction is mild cognitive impairment, is they're saying you can work out your brain, learn a new instrument, learn a new language. I tell patients if you're strong in math, then go ahead and do something with words like word searches or crosswords. If you're strong with words, do something with math, like the little booklets they have at the dollar store to long division, Sudoku, whatever you prefer. Spiritual wellness is finding purpose, value, and meaning in your life with or without organized religion, participating in activities that are consistent with your beliefs and values. Vocational wellness, preparing for and participating in work that provides personal satisfaction and life enrichment that is consistent with your values, goals, and lifestyle. You contribute your unique gifts, skills, and talents to work that is personally meaningful and rewarding. 65 and above, since you're eligible for Social Security, I tell patients if they want to retire, that's fine, but pick something else they want to do, whether read to children, volunteer at the library, but do something to stay active that you enjoy, paid or unpaid, your choice. Defining retirement. So retirement, here's a summary. You can redefine the goals of this phase. E for exercise and experience. T for tolerate and trust. I for inspire and impact. R for relax, respond, and recreate. E for embrace. M for manage your finances well. E for explore. N for nurture bonds. And T, train and teach. Retirement changed during COVID, so people had to reset their expectations. You can't help getting older, but you don't have to get old. That's a quote from George Burns. Now, in summary, CDC had a summary, and there was a citation page at the end, which I accidentally erased because I'm not a very big techie, but we'll have that available to you online. So in summary, by the CDC, 6 tips for healthy aging and to remain active and independent as long as possible. Eat and drink healthy. Make healthy choices like fruit, vegetables, whole grains, lean meats, low-fat dairy, and water. Number 2, move more, sit less throughout the day. Being active can help you prevent, delay, and manage chronic diseases, improve your balance, stamina, reduce risk of falls, and improve brain health. Summarize it again, 150 hours a week. And then 3, don't use tobacco. If you use tobacco, take the first step by calling 1-800-QUIT-NOW. And actually, it's a great source. One patient did it, and they talked her out of using a cigarette. 4, get regular checkups. Visit your doctor for preventive services, not just when you're sick. It can prevent disease and find early problems when treatment is more effective. 5, know your family history. Share your family history with your doctor who can help take steps to prevent chronic diseases or catch them early. If you're adopted, please let us know that, and we'll plan on doing all the screening. 6, be aware of changes in brain health. Everyone's brain changes as they age, but dementia is not a normal part of aging. See your doctor if you have questions about memory or brain health. Now I'm going to open up to questions.
I think we did have one question, and it was the best way to reduce weight.
So the best way to reduce weight, they're saying that you exercise for 30-40 minutes that day. You cut back by 200 calories that day. If you're not exercising that day, you cut back by 500 calories. Having said that, there's a group that we use that does nutrition online. They tell everybody they do not like intermittent fasting. They say to eat breakfast within 30 minutes of waking up, and they recommend small meals every 3 to 4 hours. That way you never go crazy on anything. There are some newer medications now that everybody's asking about. Everyone wants some, either Victoza or Ozempic. Most insurances won't cover them unless you're diabetic. There are some compounded versions available. Ozempic, if you're paying for it private pay, is like $1,200. Most people don't want to pay that much. There are some compounded versions. The oral is a version of Rybelsus, but it's once a week. It runs about $150 a month. And then the shot version of semaglutide is from in Austin, it runs about $180 a month. Those are options, but there's side effects of those, reflux or heartburn and constipation. And some people can even get nausea and vomiting. The main thing is to go ahead and find a healthy way, because you want to find a way to lose weight and keep it off and realize that you're going to have to maintain your weight. Americans are great about losing weight, but we have trouble maintaining it after 2 years.
Okay. So far that was the only question.
Are there any more questions?
It says 3 on chat. Do I need to open that up? Does
Um,
chat mean anything?
Those are just previous
Okay.
comments that we had.
If you have a question, you're more than welcome to go ahead and ask on your mic.
Oh, the only thing I didn't bring up is vaccines, a little more complicated. We can talk about it later episode. Realize there's a new RSV vaccine recommended for age 65 and above. Flu shots out now. It's hit a little early. We usually recommend getting it by Halloween. Pneumonia is once a lifetime. It does prevent strep pneumonia that killed Jim Henson, the man that invented Muppets. It travels to your blood quickly. You don't know how sick you are. 65 and above, that's recommended. Shingrix depends on your insurance. Now, RSV, they're not all covering it yet because it's slow. So even though it says your RSV is not covered, check back with your pharmacy in 2 to 3 months and it may be covered at a later date. Prevnar usually is once a lifetime, but there's 2 different ones. Pneumonia, you do need them every 5 years if you have no spleen or if you have COPD, asthma, or diabetes. Well, thank you for your time today. I really appreciate it. And we'll have the information online. You can go ahead and access it. And we appreciate your time, and all stay healthy and be sure and see your doctor for a screening exam.